Here is something every political party in New Zealand needs to understand. Between 600,000 and 700,000 people are viewing, commenting, sharing or engaging with my Facebook content every month. I'm not paying for advertising. This is organic reach. It reflects the mood of the nation on an issue that underpins everything else we debate: health and access to medicines. Yet no political party has offered New Zealanders a complete, fully costed and time-bound treatment pathway. ACT has made a meaningful start by proposing an additional 1% for Pharmac's medicine budget each year for 7 years. I want to acknowledge that. But I have not seen any other political party meaningfully address access to medicines or even discuss full treatment pathways. And you have to ask yourself why. Why, when around 600,000 New Zealanders cannot access the medicines they need? This is not a priority across the political spectrum. Why are parties not fronting up to offer New Zealanders the strongest and most comprehensive solution? Why are medicines still being treated as a peripheral issue when health underpins our ability to work, raise families, participate in our communities and contribute to the economy? I cannot become excited about 1% when the 17,096 people who signed my petition were effectively dismissed by the Petitions Committee with 2 words to the House: take note. They dismissed our voices of all New Zealanders for an aggressive cancer where the global treatment for triple-negative breast cancer is provided in 40 countries, not New Zealand. So 1% may or may not guarantee my request, nor does it have a time-bound start date. The Petitions Committee dismissed the evidence I presented as a former cancer patient who will not personally benefit if this treatment is funded. I've already lost. They dismissed the more than 1,200 hours I've poured into advocating for the people who will be diagnosed after me. A politically astute party would have approached me and asked, what have you learned? What are New Zealanders telling you? How can you help us design and deliver something the public can trust? That said, one party did meet with me and has said my work has helped them define their health policy. But you have to know this inside out to deliver, and the people need to know you, and nothing has yet been put on the table. You see, trust matters, and reach matters, and credibility matters, and most of all, delivery matters more than any other election promise. Approximately 600,000 New Zealanders, as I said, are reportedly unable to access the medicines they need. Now consider the partners, parents, children and loved ones affected alongside them. That is potentially 1.2 million New Zealanders directly touched by medicine inequity. They're not automatically one voting bloc, and parliamentary seats cannot be calculated with perfect simplicity. But proportionally, 600,000 votes could represent around 25 seats, while 1.2 million could have the electoral weight of approximately 50 seats, depending on voter turnout, party votes, electoral votes, and the final composition of Parliament. The precise number is not the central point. The point is that this issue is politically significant, nationally consequential, and deeply personal to an enormous number of New Zealanders. Turning around access to health and medicines is not rocket science. It requires political courage, sound governance, an agreed roadmap, sustainable investment, measurable outcomes, and disciplined execution. But here is the question voters will ask. Would you trust a health and medicines policy without someone credible and experienced driving it? An election promise is still only a promise. Without the numbers, the implementation plan, the people responsible, and bipartisan cross-party support, voters have been asked to complete the dots themselves, and New Zealanders have heard enough promises. A credible commitment must be time-bound. It should clearly state what will be done, how it will be funded, who has agreed to support it, and what will it be actioned within the first 100 days or longer. The strongest announcement would not be another party standing alone behind a podium. It would be political leaders from across the House standing together and saying, whatever government New Zealand elects, this treatment pathway will proceed. That is certainty, that is maturity, that is leadership. So, here is my sage advice to politicians and aspiring politicians across the left, centre and right. Start demonstrating unity. Stop operating in silos. Set aside the infighting egos and arrogance. New Zealanders are looking for certainty, not ideation without a roadmap. We're looking for a country we can be proud of, led by people capable of working together for the betterment of New Zealanders who want people to live and not only to be around for this election cycle, but for future generations. Your undoing may be your failure to understand that. And sadly, if you do not heed this message, the greater loss will belong to our country and our people. To voters, I say this: do not be drawn in by promises that deliver only partial treatment pathways. A diagnosis without access to treatment can become a cruel road of financial hardship, desperate fundraising, and the sale of everything a family has built. For others, it becomes a long and devastating decline of no treatment, while knowing treatment exists elsewhere but remains beyond their reach. Prioritise health and medicines when deciding where your vote will go. Ask every party now, is the pathway that your party has complete? Is it funded? Is it time-bound? Who will be accountable for delivering it? Does it have sufficient cross-party bipartisan support to survive beyond an election? Because without your health and ultimately without your life, what else is there to discuss? I've just given political parties a clear indication of how to earn the confidence of hundreds of thousands of New Zealanders. But doing so will require egos and arrogance, as I said, to be set aside. It will require collaboration over political theatre, and it will require those seeking office to remember that public service must be about good governance, genuine leadership, and service to the people with a sustainable strategy. The nation is watching, the nation is waiting. Who is prepared to listen, unite, and deliver?